specialize in prenatal, postpartum, and pediatric chiropractic care, along with prenatal and postpartum fitness and rehab. And I'm out of Lafayette in Louisville, Colorado. And I'm going to show you how to prepare for birth with your partner. So we want to reduce as many restrictions as we possibly can in the abdominal region and the pelvic region. And the reason why is we just want to allow the baby as much space as possible to get in an optimal position for birth, and during the labor and birth process to give them as much room as they can to shift the way they need to get through the pelvis and out of the birth canal. So your partner is going to be a great resource for you. This is something that you need to have 5 to 10 minutes to work together to do muscle releases and just opening up of the pelvis and the abdomen. And I have further breakouts to show you how to lay on your belly with pillows and how to get into the abdominal wall to release the abs and to also get into the round ligaments, something that you can do yourself or that your partner can help you with. So in my office when I'm working, I am working on a table, but this is a great surface, a bed, to utilize your partner to help you. Now again, this is something that I recommend 5 to 10 minutes of, maybe 4 to 5 times a week if you have the ability to, especially towards those last few weeks to open up any restrictions you can. So let's dive in. So we're going to demo this on a bed because most people don't have a table like we do in a chiropractic office or a PT facility. So the bed is going to be the best opportunity for you and your partner to work together to prepare. And then one thing that you can do with your pregnant belly, and I have a couple other videos to demo this as well, is you can take one of those big pregnancy pillows if you have one, roll it into a circle, put your belly in there, or you can take pillows and stack them up underneath your hips. So your hips are elevated and then your belly will just drop down and slightly rest onto the bed. So what we're going to start with is I'm going to be going face down on the bed to the side, and we're going to get into the glute muscles. So my partner's going to help me here. He's going to use his elbow, and I'm going to give him feedback. So if it's too much pressure, just let them know. He can use a fist as well. And you can see how he's taking my leg and bringing it out and then in as he's pressing onto my glutes. And you can spend a couple minutes here, just depends on how much time that you have. And you can see he's getting into all different areas. So he's getting into the side, the middle, and we would do this on both sides, but for the video, we're just going to demo on one side. Now, another thing that can feel really good and help open up the pelvis as well is getting into the lumbar paraspinals, which is the low back muscles that go right along the spine. And those insert in onto the sacrum, which is part of the pelvis. So they're attaching all the different lumbar spine, and this just feels good because of all of the pressure and weight we have on the front side. So one, this is just relief, but it also is part of the picture and opening up the lower body. So down on your belly, you don't have to be here for very long, working on the glute muscles and the low back. And then once we flip over, and I have another video on this of belly massage and round ligament massage, so that's something you can watch more in detail. But essentially, and I don't have my pregnant belly anymore, there is an oblique movement your partner can do where they squeeze into your side here, and then they help drop your legs to the side. And you should be as relaxed as you can, just opening up those abdominals. So he's squeezing my side and then dropping to the side. So it's getting the obliques. And this is something that gives feedback. If it's not enough pressure, ask for more. If it's too much, ask them to take the pressure away. Another area they can work on is the round ligaments, which comes from the pubic bone and goes up. And essentially, they're just going to massage down in this lower region. And they don't have to be in the exact spot, but anything will help. So opening up the round ligaments, opening up the abdominals. And I'll show you a more detailed video of this on YouTube. Now, another thing that gets really tight that is really good to open up during the end of pregnancy is your hip flexor. So that's the muscle that helps do this for your hip. And your partner is just going to help you stretch it out. So you're just going to bring your leg off of the bed and you're going to hold here. They can apply a little bit of an overpressure, meaning he's going to put a little bit of pressure on my knee. But you can see he's stabilizing my hip right here. And hold for roughly a minute. And then the last movement we'll have you do is a sideline release. So you're going to come to the edge of the bed. They'll be right next to you so you don't feel like you're going to fall off. You're going to keep your hips stacked so that he's going to put the pressure on my hips to keep them stacked. And then my leg is going to drop off of the table. So if you can just move so they can kind of see that. So you can see my leg is dropping off, but my hips are stacked because he's holding. So he's gonna come back in just because he's gonna be supporting, making sure I don't fall off. And I should be relaxed as possible in this position. So I shouldn't be guarding or anything. I should be completely relaxed. And he's just keeping my hips stacked, a little bit of an overpressure through my hips, and then my leg again is hanging off the side. Good. So those are the main things, is on your belly. He's gonna help me with opening up my glute muscles, releasing those, working on my low back muscles. On the front, once I flip over, working on my obliques, trying to get into my lower abdominals or my round ligaments, working on my hip flexors by helping me open them up and relax, so stretching those out, and then that sideline release position. And those are going to be the main things that your partner can help you with. It's going to be a 5 to 10 minute routine. And again, you can go along the side of bed, which would be the easiest for you. And then you would do both sides. So we demoed just one side, you would do both sides.